June is Men's Health Month, and it's important to check in with your doctor and make note of any issues you have that might be out of the ordinary. Today, we have Dr. Todd Waldman, a urologist at Idaho Urological Institute. And even more special, Dr. Waldman, you were our very own Larry Gebhardt's doctor as well.
It's true, yeah.
And you saw Larry specifically for, as it relates to his prostate cancer.
Correct, yeah.
So we know that prostate cancer is the second leading cause of cancer death in men. Why is that?
It's very common. Most prostate cancers are not fatal. Only about 5% actually lead to someone's death. But the problem is there's just so much prostate cancer that when you work the numbers, that even that 5% ends up being cause of a lot of death.
And what are some signs and symptoms? Like, do people catch this early?
Well, most men don't have symptoms unless they have pretty advanced prostate cancer. So it's something that we screen for with a blood test and a physical exam usually.
Okay. So what may be like the most common thing that they would come in and see you for?
As a urologist, patients are usually referred to us once someone's identified that there might be a problem, and that would be an abnormality most commonly with their blood test. The PSA is what that blood test is.
Got it. Okay. And so you have new technology that's really helping you in this fight. Talk about that and the PET scans that you guys do.
So traditionally for prostate cancer, when we've attempted to try to stage patients and identify the extent of their cancer, we've been limited to being able to use a bone scan and a CAT scan. And those imaging modalities miss a lot of cancer that has already spread, and it doesn't accurately stage very many patients. But within the last 8 months, 7 months, in Boise, we've had access to this particular PET scan that is unique or is particular for prostate cancer.
Wow.
And that has allowed us to more accurately identify exactly what men have, where it is, the extent of their disease.
Do you have to refer them to get that PET scan, or would they get it prior to seeing you?
No, that's almost always a urologist that is going to order that after we've diagnosed the patient with prostate cancer.
Wow, so the technology is just continually advancing.
Yeah.
That's good. What are some of the ways that men can be proactive about their health? There's this, idea out there that men aren't always as proactive in seeing physicians as women are.
I mean, it really is as simple as going to see your primary care doctor. And as a urologist, I'm always encouraging men when they go see their primary care doctor to ask them to do the screening test for prostate cancer.
Okay, so blood tests.
And a physical exam.
Physical exam, and then if it advances, then you would do that more advanced PET scan.
Well, if something is abnormal with either of those, then the patient would be referred to a urologist.
Got it.
If it's concerning enough, then the urologist would talk about doing a biopsy of the prostate.
Okay.
That's how the diagnosis is made. Once the diagnosis is made and you see that someone has prostate cancer, that's when a PET scan can be useful.
Okay. I'm just curious, and this isn't something we discussed prior, but are your wait lists long? Is it easy to get in to see you or no?
We're very busy, but we usually can get patients in within a couple weeks or so.
Good.
So, yeah.
Okay. Anything we're forgetting to ask that you want people to know about that are watching this?
Oh, I think the biggest thing with the PET scan that is so exciting is it's allowing us to better select treatment because we can more accurately identify the extent of a patient's prostate cancer, figure out where it is, and we are getting better because of that with selecting the right treatment for the right patient. So.
All positive. All right, doctor, thank you so much, and thank you for joining us. We will be right back.